the Metastatic Breast Cancer and Grief webinar presented by the Breast Cancer Resource Center in Austin, Texas. My name is Sandra Bravo, and I am a licensed professional counselor in the Austin area, specializing in anxiety and trauma, specifically with women going through the breast cancer journey. So let's start at the beginning. The clients that I've spoken with talk about how they will never forget the memory of receiving a diagnosis. And the diagnosis could have been phrased in a variety of different ways. You may have heard metastatic breast cancer, stage 4 breast cancer, advanced breast cancer, or that phrase no one wants to hear, your cancer has spread. I've been told many times by women that they feel like they're thrown onto this very dark, treacherous path where it's hard to see light and it's hard to see anything at the end, or if any way out. Sometimes wanting to just sit down and give up. But with time, there are many people who begin to see that light and memories of things in the past that give them hope. So let's talk about that journey, that traveling down the path. In the field of psychology, we have yet to find a good way to explain the stages of a grief. It's very specific to each individual person. But the one person that has been able to give us kind of a guideline for what it might look like is Dr. Elizabeth Kubler-Ross. You've probably heard her name, and there is a link to her foundation at the bottom of this slide if you want to learn more. But I'll just briefly touch on the 5 stages of dealing with one's mortality, which is something all of us will do. Receiving a diagnosis of cancer makes us do it a little earlier than what we may have anticipated. So the first stage is shock and denial. It takes some time for that type of a diagnosis to really make sense for an individual. And please know that there are no specific timelines here. Some people will go through a stage quickly, and some people will take a little bit longer. They'll take their time to go through a stage. It just depends on you, your life, and your circumstances. And that's okay, whatever it looks like for you to go through this process. Once you have allowed that diagnosis to become part of your reality, you may find yourself feeling a lot of anger. And this anger might be directed at yourself. Why didn't I do this? Why didn't I do that? It might be anger at family members or the medical caregivers. Why didn't they do this? Why didn't they do that? And it could even be to your faith system, your higher power. How could my faith, how could my higher power allow this to happen to me? Anger is a healthy, appropriate emotion to something like a cancer diagnosis. Anger means I matter. But anger is not to be acted out, it's to be acted upon. So it's very useful to be able to identify this feeling and then to do something with it, not just stuff it down and pretend that it's not happening. The next stage is the bargaining stage. In each of these stages, you may find yourself doing these things with yourself, making promises maybe to yourself. I'll stop working so hard. I'll jog every day. I'll eat better. Or with your friends, family, caregivers. I'll be a nicer person. I'll volunteer more. And again, maybe with your higher power. You try to make promises if you'll just take this away. And then the next stage is depression. Now, I want to be very clear here that as a therapist, when I diagnose someone with clinical depression, that is something most people will never experience. This is a very, very low point where someone is not taking showers, they're not eating, or they're eating to a point of causing health problems. They're not getting out of bed. They find zero joy in any of their old activities or relationships. There's sadness, and all of us experience sadness throughout life. So there's something in between that. Well, there's a lot of different things in between that, right? Clinical depression lasts for weeks at a time. Sadness comes and goes. Depression might be a few days of not wanting to get out of bed, but if you find yourself not wanting to get out of bed for weeks, I highly encourage you to seek assistance immediately. But it makes sense that you're going to feel some extreme sadness with receiving this type of a diagnosis. Finally, there is acceptance. Accepting that this is my life. This is what's happening. And with acceptance, there is this movement towards, okay, what do I do now? You're able to make plans and to think about what you want for your future, however that may look for you. Now, going through these stages doesn't mean you will not revisit them. It's possible you may return to these stages from time to time. Many people will return to all of these stages in this whole process on certain anniversary dates from this journey. For some people, it is their diagnosis date. For some people, it's the first day of chemo or the last day of chemo or a bad experience with radiation, surgery. So it's important to know that, oh, you know what? This time of the year is rough for me because this is when I was beginning or was in the middle of or the end of my cancer journey. So what is grief? As a therapist, for many years, I looked for a good definition of what grief was, and I could never really find one, so I developed my own. So after experiencing a loss, a significant loss, an individual will begin the ongoing process. That's right, it doesn't just end after a week or a month necessarily, of learning a new way to love themselves, a new body, others, people that may have said things that were hurtful during your process, and the world, a world where something like this could happen to me or to someone I love. It's definitely a process that takes time, and unfortunately, no one can tell you how much time that's going to take. So that ambiguity is also something that is challenging to deal with, is not knowing, well, if you could just tell me how many months it'll be, then I can have some hope. But unfortunately, no one can give you that answer. So what can I do? Seems like a logical question. So you can't really speed this process along. I haven't found anything to help people speed this along. And it could even be harmful to try to speed someone along their grieving process. So as a therapist, I can tell you what I suggest. I suggest really taking good care of your body as you go through this journey. So paying attention to how you're sleeping, how you're eating, how much fluid you're getting, and how much you're moving your body. And now these all are very specific to you. So you do as much as you can. And if you're having quite a struggle with one of these or all of these, ask for help, talk to your medical caregivers. It's hard to focus on anything if you're not getting enough sleep. If you're in pain, it's hard to focus on much other than your pain. So making sure that you take care of your bodily needs is very important. The second thing that is really important is to maintain social connections with family, friends, support groups, if they work for you. If support groups don't work for you, that's okay. You don't have to do them. Community organizations might be more fitting for you. Then do that, or a faith community. But if it doesn't work for you, that's okay too. I just wanted to give you many options. isolating is one of the things that is dangerous because that can definitely lead you to clinical depression, and we want to avoid that. The other thing that I want to be very clear about is having social connections that are healthy. Having connection with people just to have connection with people might be harmful if they are unhealthy connections. So I am definitely promoting healthy social connections. As you go through this breast cancer journey, you may find yourself actually limiting time with certain friends or family because you may not have the energy to give them as much as you have in the past. And that's okay for right now as you take care of yourself. The third thing on my list might be a little more challenging for you, and that's finding moments of peace in your day. Giving yourself a break from thinking about cancer is a wonderful gift to give yourself, even if it's just for a minute. And what might be peaceful for you might not be peaceful for me. And so again, this is very specific for you. What would this look like? Is it taking a bath? Is it singing in the car? Is it having a dance party in your living room? Is it reading a trashy romance novel? Is it drawing? Is it walking with your dog? Is it just sitting outside and listening to the birds? Whatever it is, and you may have forgotten because you've been so busy with doctor's appointments, maybe take a moment to think about what in the past has brought moments of peace to me, and try them out. If they don't work, cross them off your list. If they work, you can do more of them. And finally, if hearing me offer these suggestions feels overwhelming and you think, what is this lady talking about? She has no idea what I'm going through. If you're feeling overwhelmed, I highly recommend you seek professional help. Find a therapist, a spiritual director, someone that can help you organize your thoughts, maybe prioritize, and help you feel less overwhelmed. It's okay to ask for help. So I was saying earlier that about anger, that it's not good to just stuff your anger down, that letting your anger be known is helpful, of course, in a healthy, safe way. So I encourage you to speak up about all of your feelings, about all of your experiences in a safe place. That's why support groups can be very helpful. You can say things in support groups with other people that are experiencing chemotherapy or radiation or surgery, or the diagnosis of just something like cancer. You can say things to them that maybe other people might take differently. And I think you know what I mean by that. Sometimes people with cancer can laugh about things that other people can't. And there's a gift in that. So these are three of my favorite women. Audre Lorde is a writer who wrote the cancer journals. She was one of the first women to write about having a bilateral mastectomy without reconstruction. And she said, I am a post-mastectomy woman who believes our feelings need voice in order to be recognized, respected, and of use. And I think that is a wonderful quote. And I think journaling is another great way to be able to get all of those feelings out of you and somewhere else. One of my favorite things to do when I'm angry is journal and then rip up my page and throw it away. Sometimes you can even burn it. I like to burn things. It feels very releasing. Dr. Clarissa Pinkolas-Estes is a Jungian-trained psychoanalyst, and she says, what is wounded and without thought wounds others. If you find it hard to care for yourself because you feel like that's selfish, you can think about how important it would be to take care of yourself for other people. If other people in your life are worrying about you, then they have less energy and space to think about other things. So maybe taking really good care of yourself is the greatest gift you can give to the people you love. And woundedness isn't always physical and it isn't always emotional, it's both. So making sure that you allow healing for your emotional wounds and your physical wounds. And then the social worker, Insoo Kim Berg, and one of the founders of solution-focused brief therapy, said, "That's a way to see it, and there's also another way to see it." So I have this picture, this photo of this beautiful flower that some people call a weed. And so I feel like this was a great photo to put next to Insoo Kim Berg's quote, is sometimes people see weeds and sometimes people see flowers. And for me, what's most important is, what do you see? So as we come to the end of this webinar, I would just like to offer you this. Grieving takes time, and receiving a diagnosis of metastatic breast cancer may throw you on a dark, treacherous path. But with time and compassion and care, you may find yourself at the end of an old path and onto a new path. A path with new growth, with more light, and it may feel more balanced, and it might feel a little bit easier. But it takes time. Please feel free to reach out to me if you have any questions. I'm always happy to answer questions. And I would just like to thank the Breast Cancer Resource Center here in Austin for inviting me to be part of this wonderful and supportive community. Thank you all.